Look, Mom, no hands. Or at least no braces, no electric jacket. First thing out of bed. Well, not first thing. I had 170 milligrams of caffeine, one caffeine pill, and 1 cup of espresso, which is a lot less than the 500 plus that it takes me to get cranking in my brain. Am I wide awake? No. Do I hurt a little? Yeah. Am I in agony? Clearly not. And it helps that I'm in the room with the heat vent at my boyfriend's house, with the door shut. That can't hurt. But then again, I also happen to have severe iron deficiency anemia on top of my usuals. So that explains why I've been extra cold. But I usually put on the electric jacket for my muscles and my pain. Not because I'm cold, although I usually am cold because the best temperature scientifically to sleep at is around 65. So I keep the heat down and the house dark at night. And then when I wake up, it's cold. And anemia makes you cold. But anyway, the point is, it's nice to feel this quickly after waking up. I haven't taken my psych meds, haven't taken my oral RA meds, haven't taken any OTCs. My liver is probably, and my kidneys, so very grateful for this break. Miracle medication. Miracle medication that my doctor won't talk to me about prescribing until we have our follow-up appointment April 6th. I was hoping that would happen a little sooner, seeing as how my labs came back all screwed up. But I have heard nothing, and I left 2 messages, and I don't want to be pushy. Who knows? Excuse me. Maybe she's doing the best possible scenario. Let's be optimistic here. Cup half full. Trying not to become jaded. That's a good word for it. Not become jaded or cynic. That maybe she hasn't called back because she, in the past, has been pretty good about turning over quick on the return with messed up labs. Maybe she is doing the best possible case scenario and trying to put it in context of the larger picture of the information she already has on me, plus the information I requested that my doctors swap their labs, because I asked her, my rheumatologist, immunologist, to do hormones, but she said that's something your primary has to do. That's in his jurisdiction. So I called my primary, who usually will not order me labs, since I was lucked out. I think he retired last week, so I think he was just like, whatever, I don't even have to take care of it, so I'll just order it for her, whatever she wants, because he's usually very dismissive. He usually brings up my bipolar disorder every single appointment, even though it has not been a problem. It's been under control since 2015. He'll bring it up because he saw me psychotic, and it's bad enough that I had it on my label, but after you come into your doctor's office like that a few times, you don't live it down. If you got a doctor with not such good bedside manner. But so anything I would ask, we would just assume it was because I was a nutter. And I'm not saying people that are mentally ill because me are nutters. And that's just the way that he looked at it. Like he would tell the nurses every time a nurse would come in, the nurse would do their thing. He'd come in, he'd talk to me about whatever I was there for, which I hardly ever go to my primary. And he would tell the nurses things like, well, I've seen her. She's so calm right now. I've seen her bouncing off the walls. She just, crying and acting all sorts of whatever. Like, he'd bring stuff like that up, like, completely out of context. There's no need to spread my mental illness around the office when it's not even related to my visit. I think I had a sinus infection or something that time, so I had to go to him for spray. But so it was always seen through the scope of my bipolar. So I think maybe because he's retired now, he was just like, whatever. So I got my hormone panel, and that was messed up. And so I called both offices. The receptionists are great. My doctor, I like my rheumatologist, immunologist. She's usually faster returning results. So I'm hoping maybe whatever new doctor I get at my primary will be better, because 2 new doctors are coming into the office, and they will be assigned randomly my doctor's cases, and then they will determine who they're going to keep, who they're not. If they cut you got to go find a new primary, which I had been debating anyway, due to his bias toward my mental illness. So I might just wind up with a new doctor at my familiar location who's good. Or they might decide I'm too much and I will be on the search for a better primary. But anyway, the receptionists, all of them, at my primary's office are fantastic. They're sweet, they're wonderful. I even joked with one of them, she's been there forever. She found, I double checked to make sure that they faxed over the results from my rheumatologist so that they would have my current information and my current labs. So whatever doctor worked with me would know where I stand right now and all my diagnoses from over there. And she was like, we haven't received any labs. Wait, don't let me say that. There's like only 500 places they could be. So give me a minute and let me look. I'm not the only one that works here who knows where anybody puts anything. She's just great. She's like, I'm like, you do such a great job. She's like, don't tell anyone. I'm trying to get myself fired. But anyway, sidetracked. It's nice. It's easy to get sidetracked when you feel good. Your brain is not focused on the pain. This is tolerable. Anyway, so my primary has all my labs, my current diagnoses, at least from my rheumatologist, immunologist, and soon I will be getting a call from a new primary from over there, but they're supposed to call me and deal with the estrogen issue. No one has called me. And then rheumatology is supposed to call me and deal with my whacked CBC and iron panel. And nobody's called me. But this is the second time in like a year and a half, maybe a little over a year, that my iron has been whacked, and it's my iron is really whacked this time, and my CBC is messed up too. So I was hoping that I would get the call back like I did last time about the first time I was anemic, when they saw that my vector score for my RA went like through the roof, even though I was on oral medication, and put me on Humira. She's usually really fast about addressing things, which is like impressively fast. I know I'm not the only patient. I give courtesy, but impressively fast, and she's very sweet. She's young too. She's the second. There's the lady whose private practice it is, and then I'm under like her nurse practitioner. She's probably my age, but she's beautiful and brilliant and fast and sweet, and doesn't dismiss me in any kind of way. And she finds me interesting. She's like, "You're like a case study, a mystery to solve." So maybe, cross his fingers, she's being slow to return my call about my results, because instead of just treating the call her back in, get her some more iron infusion, she's taking the larger context of all my symptoms and my previous abnormal issues that she's found into context, and conferring and trying to figure out what might be going on underneath the surface. That would be like the best case scenario. For that, I'm willing to be patient. And in the meantime, I am glad I found a miracle medication that, at least for me specifically, whatever is going on with me, works to dramatically reduce the pain that I experience first thing in the morning. And that puts me in a much better mood. But I want it to be prescribed to me. And it's not a controlled substance. It's not a heavy-duty painkiller. It's not anything like that. But for me specifically, it works. And I feel more comfortable sharing what it is when I get it formally prescribed to me, and when I know what my complete diagnostic box is, what my final labels are going to wind up being. And then further, even telling you guys, each case is different, especially when you're talking fibromyalgia and chronic fatigue syndrome. It could come from a lot of different things, just like COVID-19 people have the same virus, the same syndrome. So when you're talking CFS, it could come from a billion different viruses. It could have come from a surgery, a severe trauma to the body. So fibromyalgia could be triggered from a bunch of different things. So it might not be the same problem that you're dealing with as the next person with the same diagnosis. So the same medications might not be effective for you. They might not be effective for your overall health. They might not be effective combined with other medications that you're on. So I'll have to disclaim, know more about my own case, know more about etc., and don't take any meds without asking your doctor. But I will tell you when I know a little bit more, especially if she will prescribe them to me. But in the meantime, I have Zoom therapy at 9 a.m. So, I'm usually up this early anyway, but I'm usually not this functional this early. Yes, I did post that I had therapy just yesterday. It worked out strangely. I had a lag in therapists. My therapist got promoted to the boss of all the therapists, and they took about 4 months to hook me up with a therapist, and that was not good, because there is some stuff going on besides just my chronic illness in my life, and so I tried BetterHelp, but by the time I got around to navigating that and getting it hooked up, right after I got on there, they got me a therapist. So now I'm having temporary dual therapy. They're just making sure they don't overlap with each other. They're covering different areas. My therapist from the community mental health is observing my bipolar and trauma therapy. I forget what else she's covering. And my BetterHelp therapist, who I just text, so I don't know what he looks like. He doesn't know what I look like. There's complete anonymity. You can pick between text, video, or telephone calls, and I pick text. I don't know why I picked text, but hey, it works. We've wound up on topics I would otherwise probably wouldn't have talked about. So we're going to cover some of the things in his treatment plan. He's like, wants to make sure that I don't get confusing, conflicting information. So is assertiveness and identifying my own needs and being able to advocate for myself better. Dealing with medical stress and chronic illness stress, that kind of stuff. And bipolar trauma and healthy boundaries, all that kind of stuff is my community mental health therapist. So maybe I'll be out of my pajamas for our Zoom. She has not seen me out of my pajamas but one time. And that's because I have these chronic illnesses, and I wake up so sick every day that I'm not well usually, and I meet her between like 12 and 2, but her only opening was 9 a.m. And the one time she saw me dressed, she thought I was slipping into hypomania. She thought I was having a bipolar issue, and I was just feeling well enough that I had clothes on rather than my pajamas, and I brushed my hair and stuff. That's bad. So she might think I'm completely manic this morning when I get out of my unicorn. Maybe I'll just stay in my unicorn. What would mental health think about me dressed as a unicorn? Maybe I'll get I'll get a nice long vacation for 72 hours. But I don't know what she's going to think to see me at 9 a.m. all ready to go. So that's my story, and I'm sticking to it. Good morning, goodbye.